So male factor infertility is basically a category of infertility where we're dealing with the male or the sperm donor, and it causes about 30% of infertility cases that we see. And when we talk about male factor infertility, obviously what we do is we do a consult with the husband and wife, or female partner and male partner, for the fertility workup. And sometimes it's going to be a female person with using a sperm from the cryobank, but we still have to look at the sperm to evaluate the potential for fertility, and that's the male compartment. We look at sperm by having someone who is going to be involved in this process abstain from intercourse for about 2 to 5 days. And then we ask them to ejaculate into a cup, and the analysis is done about half an hour, 40 minutes later. We look at the volume, and we want the volume to be over 1 to 2 cc's, or mLs. There are 3 components in the evaluation of fertility. One is the female component of ovarian function, one is the pelvis and fallopian tube component, and one is the male component. We're going to talk about male component today, and we evaluate that by doing a semen analysis, and that means the evaluation of sperm. And we look at the volume of sperm, which should be between 1 or 2 cc's or more. We look at the concentration of sperm, that means the amount of sperm within a volume, and that number needs to be over 20 million. We look at the count of sperm, which needs to be over 40 million. We look at motility, and that needs to be over 50% of sperm that's visualized on under the microscope should be moving or more. And we look at the percentage of normal sperm, and based on the strict criteria called Kruger criteria, that needs to be over 14% normal. If the sperm is normal, then we're done. If the sperm is not normal, then we have to reevaluate the semen analysis, because an abnormal semen analysis does not mean that there's a problem. If repeated semen analysis after the first one is abnormal, so 2 or 3 consecutive sperms are abnormal, then that means that there is a problem. And the question becomes, how much of a problem? Is it a minor problem, or we can just adjust by doing a sperm wash? Or is it a severe problem which requires aggressive treatments like in vitro fertilization and injection of sperm into the egg called ICSI? There are people who have medical conditions who don't know about them, and the first time they find out about it is through our semen analysis. So it's a very important part of the process. But the treatments cannot be in a vacuum. We have to also look at the pelvis, the fallopian tube, the age of the female partner, and all their other tests to make the final decision on what to do to treat the patient or the couple. But assuming that all the other tests are normal and all we have is a minor sperm problem, that can be dealt with timing for them to have intercourse. That could be dealt with by doing a simple sperm wash, where we select normal sperm and concentrate it in a small volume and insert it into the cervix of the female partner, or all the way up into the uterine cavity right by the fallopian tube. And in severe cases, we might have to resort to in vitro fertilization, assisted reproductive technology, with the help of ICSI, which is the injection of a sperm, a single sperm into a single egg, and that is done in the more severe cases. Now, psychologically, to tell a man that his sperm count is abnormal, I mean, that can be taken in many different ways, and some people take it very hard. I mean, what do you mean, doctor? Well, you know, and I have no problems with performance, or I've gotten someone else pregnant. The healthy attitude towards this is to say, hey, you know, hey, thank God we found out the problem. At least we can deal with it. Can't we, doctor? And the answer is yes, then wonderful. That's all I'm looking for. And if that is the attitude, we can get through almost anything.